Hello, I'm Dr. Lorraine Maita, author of the book, Vibrance for Life, How to Live Younger and Healthier. And today I'm here to talk to you a little bit about sunscreen. My patients always ask me, what kind of sunscreen should I use? Well, you have two choices. One is a mineral-based sunscreen and the other is a chemical-based sunscreen. You want to use sunscreen that's going to block ultraviolet rays that can cause skin cancer or sunburn. Don't get a false sense of security now because nothing is 100% safe. So with that in mind, I'll tell you a little bit about the mineral-based sunscreens. The two that are most common and that are felt to be very safe and effective are zinc oxide and titanium dioxide. The pros of the mineral-based sunscreens are that they don't cause any ill effects because they don't get absorbed into the skin. The cons are that they're kind of thick and pasty, so you really have to rub them in quite hard to get rid of that white pasty look. But they do absorb and then into the skin, and they're very safe and they protect quite well. The other are chemical-based sunscreens, and some of the chemicals are known to cause some hormone disruption or sensitivities and allergic reactions. So the type of chemical that I recommend would be Maroxyl SX. Now that's not very easy to find in many products, so the next best would be avobenzone. So think of AB, avobenzone. That's a very safe, relatively safe chemical to use. The other thing to think about with sunscreen, here's some do's and don'ts. Do apply it liberally, because nobody applies the amount of sunscreen that they really need to protect themselves. Most studies show that only 1/5 of the amount is applied. Apply it frequently. Even though there are claims that it's waterproof or water resistant, the FDA is now requiring companies to label how long it really does last, because there is no such thing as waterproof, so that it will come off when you sweat or when you towel dry after swimming, or even after, of course, after swimming. So the other thing that you'd want to do is use an SPF of at least 30. Higher than that can cause some chemical reactions and sensitivities. The higher the SPF, the more likely that you are to get a greater concentration of chemicals and also greater possibility of a reaction. Do not use any sprays or powders. You can inhale them, and that we don't know what the health effects of inhaling these things are. Do not use oxybenzone. Just think, oh no. So the one that begins with the O is oh no. And don't use very high SPFs. So with that in mind, also what I recommend is not to use anything with vitamin A in it. While vitamin A is good to take internally, it's not very good to take on your skin. It can cause some reactions. So with that in mind, have a very safe and healthy summer. Thank you.